Okay. We are on and we are live. Okay. So welcome everybody to another Zoom call. It is December, what is it? December 20th?
20th today.
Wow. So Merry Christmas to everybody. I will
Thank you,
probably
you too.
talk to you again before Christmas, most of you. So Merry Christmas. Hopefully everybody's going to have a great time with their family. So let's open it up for questions that you have right now before I get to the ones that everybody asked online and such.
I don't know if we're the only callers in right at this point, but I'll start. What I want to ask you is maybe you could help to maybe sort of clarify the process of detoxification in relation to the Rife machine. So that's kind of my question is how those two work together to do what they do.
And Dr. Clowns, this is Carol, David's wife, and to add to that, as David and I talk, you know, when we were listening to Michelle talk about the coffee enemas, you know, we were understanding, like sometimes when some people would say they could hold the coffee enema in their body for 6 minutes, and then Michelle would say things like, well, that's good, it means that it's circulated in this way in your body, and then we're sort of understanding a little bit more about like how things, you know, are then eliminated. And so just in general with the detoxifying, with David, you know, with what the rice is doing, as well as with what the nutraceuticals are doing, how is his body being detoxified?
Okay, so detoxification takes place in every single cell. What's going on inside the cell is enzymatic processes, and enzymes are made by different genes. So that's where we want to look at genetic defects that people might have, because they can have restrictions on intracellular detoxification pathways if they don't make enough superoxide dismutase, or if they don't make enough catalase, or they don't make enough glutathione or NRF2 or KEAP1. So those are all the intracellular detoxification pathways. If they don't make those, there are certain herbs and different nutraceuticals that can help push those pathways. So that's why you would take different nutrients, and many of those nutrients are found in good foods. That's why, you know, you eat a lot of, change your diet instead of eating prepared foods and McDonald's and things like that. You're eating good whole foods and good vegetables because they have those nutrients in it that will help support and push those pathways. Now, the detoxification that takes place in certain cells depends on what the thing that it is that you're detoxifying, but many of those things are catalyzed in a certain way that they're made non-toxic. So, for instance, superoxide ion is catalyzed by superoxide dismutase to turn it into, add a H2 group onto it, and you end up with hydrogen peroxide that then is catalyzed further by catalase and glutathione to turn it into water that you then excrete. So then that is excreted. So some intracellular toxins are excreted then through your kidneys so it's picked up in the extracellular space through your lymph system, carried to the blood, and then excreted through the kidneys. Other chemicals like pesticides and heavy metals and such are chelated and excreted through your liver into your colon. And that's why it's so important that you're not constipated, because constipation can lead to reabsorption of those toxins.
Okay.
So the detox pathways are complicated in a sense, but if you just think of it, we got to get things out of the cell. It goes out of the cell into the space between the cells. Then you need a good, healthy lymphatic system to drain that area. And that's where exercise comes in, because The lymphatic system doesn't have a heart that's pushing it. It's only moving through the lymph system through action of contraction of the muscles. So you know, getting some exercise, contracting the muscles, even if you're sitting in a chair doing isometric exercises, getting contraction of the muscles moves the lymph. That's where doing like rebounding, one of those little trampolines, can be beneficial.
Yeah.
So you're getting it through the lymph to either to the kidneys to be excreted or to the liver to be excreted into the bowel. And that's where saunas can be helpful too, because then you're excreting extracellular matrix fluid through the pores of your skin. So you're bypassing the liver and you're bypassing the kidneys. So it takes some pressure off the kidneys and the liver. So the benefit of doing coffee enemas is it just helps support the liver detoxification. So it helps the liver dump.
Yeah.
So does that help answer that question?
Yeah, it does. Absolutely. And how does the Rife machine, how does that fit into this scenario?
The Rife machine doesn't specifically detoxify, but the Rife machine is, so it depends on what program you're doing. So if we're running cancer programs, we're helping the body kill cancer cells. So in that sense, it is a detoxification, you could say. We're getting rid of cancer cells. And there are lymph programs on there that can help stimulate lymph flow, but it's not going to stimulate lymph flow like doing rebounding or something like that. It's just going to be it's the frequencies. So that is the Rife machine, understand, is using frequency medicine. So everything in your body is frequency. So if you can stimulate the frequency of the liver, you're going to help the liver work better. So those cells are going to work better, and that's going to support the detox pathways that way. So in every single person's program, there's liver programming, because when you're killing cancer, you have to support detoxification. So I put in everybody's program known liver frequencies because we want to support that. So your overnight program is supporting detoxification, but it's supporting it by, number one, killing cancer, number two, helping stimulate the liver at its own frequency so the liver works better. So we're using frequency medicine with the Rife. We're using chemistry with like a nutrient like milk thistle that would help the liver, or PON1 that would help the PON1 pathway, or NRF2 that would help the NRF2 pathway. We're eating really good foods is chemistry to the cells to help support those pathways. The Rife is using frequencies, and then using other tools like exercise and rebounding is helping stimulate lymphatic flow, and then saunas is helping you use the skin as a detoxification pathway.
Okay.
Yeah, that's very, very good. And we were recently Googling some like YouTubes on the rebounder. We don't have one, but we want to get action on one, because also since David had that cardiac experience, we were not certain how much or how little he could even say do on a rebounder. So we've just begun to explore that tool, because it does look like it's a great way, like you said, to do the whole lymphatic,
So another good tool that you might consider are those vibration plates, and you have a picture of them in your 3-ring binder.
Okay.
So in the diet part, on the back of the diet part, there's information on the rebounder and other helps with detox pathways, and one of them is a vibration plate. So those vibration plates that you stand on, or the ones that you sit and just put your feet on, vibration stimulation into your feet helps stimulate little microscopic muscle contraction, and that helps with lymphatic detoxification as well.
That's a great tip. We missed that, but but we'll look at the binder as soon as the call is over. Yeah, that's
Yeah.
great.
Yeah.
Thank you.
Yeah, I definitely missed that part of it, but we'll check that out for sure. Unless somebody else has got another question or you've got your itinerary there, I have another question for you.
Go ahead.
Staying with the Rife machine, what I'm finding is that I'm currently getting up with leg discomfort, leg pain at times in the pelvis, the thighs, the front and the back of the thighs. And can I introduce more Rife machine during the course of the day? Is there like a point where there's too much?
Good question. So no, the only time that you could do too much rifing is if you are doing too many bacterial programs, and not to get too technical, but certain bacteria, gram-negative bacteria, have lipopolysaccharides in their cell membrane. If you kill them too fast, you liberate them, and that can stimulate an immune reaction. So if a person is autoimmune, they could kill too fast, and they could have a Herxheimer reaction. We're not talking about that with our cancer patients. So no, you can run other programs during the day. You got a lot of programs on there. You can run pain programs, you can run healing programs, whatever you want to run. You can't overdo it.
Okay, all right. And also with as far as the bulb, I know you must have answered this question many a times in the past. I was talking with Michelle last week. We're talking about this subject a little bit. She was asking how close I keep the bulb to my body. I said, within a few inches. She said, you may want to bring it a little bit closer. Any concern, any issue about actually putting it directly to the skin?
No, you can snuggle with the bulb. Yeah, absolutely.
Okay. All right. I'll introduce some more rifling then for sure.
Dr. Conner, I missed the call last week, but David was talking with Michelle about this pain and this thing about the pain. How do you figure out maybe that pain in the pelvis versus the bone versus the muscle? Was there anything else you want to ask David that Dr. Conner could say more about differentiating to try to help you as an individual understand where the pain is?
Some of the question was I cannot distinguish what bone pain is versus a pain that's coming from the muscle, from the tissue around the muscle, ligaments.
Okay, so one of the differential diagnoses in pain source would be, okay, so do I have pain upon rest? Yes, I have pain even when I'm not moving it and I'm sitting in a chair. I have this deep throb. Okay, is it worse when you contract the muscle? No. Is it worse when you're like contracting under a load? No. Then it's probably not muscle, and it's probably not tendon. At least it's not tendon of the muscle that you are contracting. So a muscle pain and a tendon pain will typically be worse upon load and will be less upon disuse. So if you have a bone pain, will typically feel like a deeper pain, and will feel like, most people have hurt, damaged a joint or sprained an ankle or hurt a muscle in the past. A deep bone pain will feel, you'll say, this just feels different. So it's a little bit less distinguishable that way. And a deep bone pain can be painful upon non-use. So as where a muscle pain, if you have an acute muscle injury, it can be painful all the time. But as the time goes on and you don't have a muscle, it's not an acute injury anymore. Typically, a muscle pain will calm down when you're not using it.
That's kind of what's happening. Certainly under a load, like climbing stairs or walking today, I could feel it in my legs. And when I get up from a sitting position or getting out of my vehicle, my leg muscles from the knees up feel pretty tight. Then they loosen up after a little bit, but it's still there. But at nighttime, I can't say that I feel it. So
okay. So let's say if I have cancer metastasized to the bone, one of the signs of that can be deep bone pain at night. So it's not worse when I'm walking around. It's not worse when I'm walking upstairs. It's usually you feel it more when you're at rest because you're not moving, you're not thinking about other things, and you're just sitting there, and then you feel this deep bone pain. And that's not always, but I'm just saying, I'm just walking you through a differential diagnosis picture of that.
Yeah, yeah.
I find that really informing, and I just kind of think that maybe what's happening with David is a combination of that he has that deep bone pain, which is metastasized cancer into the bone, and also because he hasn't been able to work in the past month. I think because he's more sedentary, that some of the pain and stuff he's feeling in his legs is because he hasn't been moving those muscles.
Absolutely. So you could get a combination, especially if you've been used to being active and now you're not as active. You could get this disuse pain where you are kind of falling out of shape, you could say.
Yeah. Maybe it is a combination that way. Okay. All right. Well, that helps for now.
Okay. Any other questions from anybody else either?
I've got a question. What is how often can you do hyperbaric treatment?
You can do hyperbaric treatment every day.
For how long?
You could do hyperbaric treatment every day for the rest of your life.
But I mean, how long each day?
I would do an hour.
Okay.
I would do an hour. If you're going to do it every day, I would do an hour. I wouldn't do it any longer than that. Did you get your unit?
Yes.
Okay. Did you start using it?
Yes, just for a half hour though, because I wanted to check with you first.
Yeah, you could go up to an hour, and you usually could bump up to an hour right away.
Okay. Thank you.
Yeah, you'll like that. That will be good. And the benefit of hyperbaric is better the more often you do it. The problem that people have with hyperbaric is that, sometimes it takes 30, 40 sessions before you even start seeing any benefit. So the more often you do it, you'll see benefit faster.
What's the concern about the eyes? I keep seeing that popping up.
Under the type of chamber that you have, you won't have any issues with the eyes.
Okay.
So if you have symptoms like your eyes hurt or your sinuses hurt, then just drop down the time amount. You probably have like an infection, a sinus infection. So that's where you can't do the hyperbaric chamber if you have sinus infection or polyps like me. I can't do it. It's just too painful. I can't pressurize. Or if you have like an ear infection, you'll know because you'll start to pressurize. You're like, I'm turning this off, and you'll unscrew the thing. So it's you'll know.
Yeah, no pain. It's been great.
Okay, perfect.
So Doc, who is using? Why would someone use a hyperbaric chamber, for instance?
So
hyperbaric
chamber is great for cancer, great for Lyme, great for brain function, Alzheimer's, injury, healing from wounds. Probably the most common use of hyperbaric chamber is a lot of professional athletes have their own hyperbaric chamber. So it's just another therapy that is highly beneficial.
So this gentleman who just called in asking about his chamber, was that a suggestion from you, from the office?
Yeah, well, I always suggest that chambers are expensive, so they're not something everybody can afford, but they're great. They're great if you could do it, if you can afford it. Then I always suggest before you purchase a chamber, you go do some sessions at somebody's office so that you know that you can tolerate it.
Yeah.
Because you can't have issues with claustrophobia, and I've had patients that go, "Oh no, I don't have any issues," and they get in there and they freak out. So
surely. Okay. Well, good to know. I'm not familiar with that, but okay. Thank you for that.
Okay, so let's get into our talk today. This might answer some questions, and we'll take questions at the end. So we got mixed questions today, and I already covered the questions on the Rife that I wanted to cover, and I want to talk about some other things. Iodine, we want to talk about that, and we want to talk about zinc and copper. So first, iodine. Iodine is a mineral that we get in our food. Now, you know that part of the problem with our food is that you can only get any mineral in a vegetable if there's minerals in the soil for the vegetables to pull in to its root in order to be in the vegetable itself. So if you're growing something in depleted soils, you're not going to have those minerals in the thing that you're growing. It's impossible. That's why I am not for hydroponic gardening, even though, wow, I could grow vegetables in my basement with this hydroponic gardening set that I bought. Really? Well, add some phosphorus and nitrogen to that water, and you will grow a nice, pretty little carrot, but it's not going to have any nutrients in it. So what good is that? So you have to, that's where organic is so important. The problem with iodine is that many of our soils in the Midwest are depleted of iodine. So we can have low iodine levels. Now, it's not as bad as it used to be years ago because people are not just eating locally anymore. My organic vegetables that I got in the grocery store today were not grown in Minnesota. So they were grown in another state that has more iodine in the soil. But testing for iodine, especially for breast cancer patients, may be a good idea. I don't recommend this for everybody, but for breast cancer patients, this is more of an option because iodine deficiencies have been shown to be at least a piece of some breast cancer cases. So that's a test that we may want to run if you have breast cancer. Copper and zinc is another thing that I'm starting to run more tests of copper and zinc because there's some new data coming out that high copper levels can feed cancer. So, and I'll put a video together on this in detail, but we don't want high copper levels. And there's some new data coming out that low zinc levels can be a problem and can be responsible for giving relatively high copper levels. So you want to do a test that measures both copper and zinc and then look at the ratio of zinc to copper or copper to zinc, because that is important with cancer. So we are starting to run those blood tests, and if you want to do that, let me know. It's a blood spot test that I send out to you, and you prick your finger and put the blood drops on this little card. You let it dry, and you mail it in, and it's a really nice little test to measure your zinc-copper ratio. In that test, we also do a urine test, and we get iodine in that same test, and some other things like lead and mercury and other metals that could be causing problems too. But that's a nice thing to look at. I was at a seminar this weekend. That's where I did those videos that you saw that I put up on Facebook. And if you haven't watched those, I really recommend that you do. But zinc and copper levels. Oh, also, somebody made a comment, I don't remember, that they missed last Zoom call. Remember, all the Zoom calls, any new videos that I create, any new information that I create, I'm putting on your Facebook page first. So you miss a Zoom call, watch it again. It'll be posted up on this Facebook page.
Very good.
I love going to seminars because I get to rub shoulders with like-minded doctors, and this one was important because there was a lot of cancer stuff at the seminar. And one of my colleagues was talking about a patient that he had that had uncontrolled prostate cancer that had spread to the bone, had spread to the lung, had spread to the liver, and it was his PSA was just flying off the roof, and it was not looking good for this older man. And he had done some research on zinc, and he decided to do an experiment because this guy was at the end of his rope. He was willing to try anything, and he injected zinc under MRI into this man's prostate, into the man's cancer on his ribs, and into the man's cancer on his lungs. I don't think he had it in his liver. And in all the areas, the cancer shrunk literally within a couple weeks. So that was like super promising. The problem is that's not necessarily quote unquote legal to do that. So find somebody to do that. I mean, because if you're going to try to get it into the prostate, you would have to do it under MRI. So this guy was out of the country that did this, so he could get by with it, but you couldn't find anybody in the States to do that. Now, if you had breast cancer, you could get a needle and inject it into your breast. That would be pretty easy. But to get it into, a deep organ, you'd have to do it under MRI or ultrasound, and that's not quite as easy. But that got me thinking, okay, so you could use a driver like DMSO with zinc. So using a driver like DMSO with zinc, that's a possibility. So if we look at a person's, here's a slide about iodine deficiency in breast cancer, but if we looked at a person's zinc and copper and their zinc copper ratio, and that was not where we wanted it to be, this is an example of a normal test there, I thought, well, what the heck, I'm going to create my own thing, and I did. So I created a zinc DMSO topical solution, and this is, you can't see it, but it's a spray bottle that you could spray it on an area. Now, if I had prostate cancer, is it going to go as deep in the prostate? No, it's not. But if I have cancer in a bone, a rib, a lung, would it go that deep? Yeah, it could. It certainly can't hurt you. So DMSO is widely used as an anti-inflammatory. So there isn't anything wrong with using DMSO. In zinc, there is really no toxic load of zinc. Now, I don't have the exact milligrams, but probably per spray, it's only about 5 milligrams of zinc, maybe at the highest, and what you'd absorb is maybe 1. So this is another solution that I'm going to introduce definitely to my breast cancer patients, that I want them to spray right on their breast, right over the tumor, and just rub it in. It just feels like a water. The only negatives with DMSO is it smells kind of garlicky, and you could get an oystery, garlicky taste in your mouth afterwards, because it literally can absorb in a minute, and you could get that taste in your mouth. I, of course, tried it on myself and did it on a bunch of areas of my body, and I didn't get that taste at all. But so I think it depends on the quantity that you use. But this is another solution to increase zinc stores. The problem with zinc is you can take it orally too, and I recommend that. But I recommend a whole food zinc, and that's the zinc liver chelate by standard process. I don't have a picture of that, but that's a whole food source of zinc. But when you absorb zinc, is it going right to the cancer site? That's the argument. And how much of it is getting right to the cancer? I don't know. Probably not a great amount. So is it good to take zinc orally? Yes, it would be good to take zinc orally, but we have to figure out another way to get it to the cancer site. And besides injecting it, using a DMSO topically is the next best solution in my mind. If anybody else has any other ideas, let me know. So this is our new zinc DMSO topical. I just put it up on the website and made a dozen or so of these today. So that's going to be available soon. So looking at iodine levels, and I always want my patients to have higher iodine levels than what is in the normal range. I think the normal urinary iodine is like 100 to 300. I want my patients over 200 at least, to maybe 500. And it's really easy to supplement iodine, and you only want to use an organic kelp-based iodine. So if you have iodine at home, a lot of people use that Lugol solution. I don't suggest that. The Lugol solution is potassium iodine. I'd rather have you have an organic food-based iodine, which would be a kelp-based iodine. It just works much better in the body, and it's just better for you. It's very easy to get anywhere. We have it in a product called selenium with iodine. It has selenium in it too, which you need for cancer as well. Enzyme use. There was some questions about using enzymes, and is there times to use enzymes and not use enzymes? So the two uses of enzymes for anyone is to help digest food, because dietary enzymes are made to help digest proteins. The enzymes are dietary enzymes that are secreted into your small intestine are made in your pancreas to help break down proteins. That's part of digestion so that you can absorb amino acids. So a person could take enzymes with each meal to help their digestion. But usually that's not what we're talking about with cancer. We're using enzymes to break up biofilms, to break up the biofilm around the cancer itself, and to help allow T cells, that's your natural killer cells, to attack the cancer. So therefore, you wouldn't take them with your food, you would take them on a more of an empty stomach. So taking enzymes in the morning, or taking enzymes right when you wake up on an empty stomach, or taking enzymes right before you go to bed are a good time to take enzymes. But if we don't have you on enzymes, I didn't recommend those. I tested you on them, and you don't need to take them. But if you are taking enzymes, that's when you would use enzymes. Is there a time when you want to refrain from taking enzymes? Typically not. Um, Enzymes are made everywhere in your body, just so you know. So enzymes, that's what genes code for. They make enzymes, and they have all sorts of different functions. So that's not what we're taking when we're taking them orally. We're taking ones that will help break down slime layers and get rid of biofilm that is the waste that's around a cancer, or help break down food. And then if you have not watched the video on the new IV gene test coming up, I am super pumped about that, as displayed on that video, because it's going to give us a real objective data. One of the things that my patients have asked for many years is, how do I know I'm getting better? And I've always said the only way to know is to compare apples with apples. Meaning if you did a CT test to find out you have cancer, you really have to do another CT test scan to see if the cancer's gone away or not. And well, we don't want to do that because that's highly invasive. It's a lot of radiation. It's costly. Well, the IV gene test is going to give us some objective data that's not going to only be qualitative, but it'll be quantitative. So it's going to give us a score. So if my score, like on this example, was 40, that would be a positive score for cancer. In a medium to high risk, meaning it's there. And I do another test in 3 months and it's a 35, I'm going the right direction. If I do another test in 3 months and it's 60, I need to change something. So it gives us good data, whether it's gone the right direction or the wrong direction, of whether we need to change something or we just need to stay the course. So that's the benefit of the IV gene test that's coming out. And I spoke with the U.S. director of that this weekend, and he thinks that, conservatively speaking, in 5 years, this may replace a lot of biopsies. Because the inherent danger of a biopsy, is that it could help spread cancer. Well, this is completely non-invasive, and it's very cost effective. And it will probably only get more cost effective over time. So this test is going to be about between $400 and $500, which is a fair price to pay for not finding out where you are with your cancer. So it's another nice objective test that I'm really excited about, that I know a lot of people are going to want to do.
Now, will that be just in your office, or
you
can
could
we go to
order
a clinic?
So you can order the kit from us, You could go to other clinics that are going to use that test, but it has to be probably a clinic that's kind of specializing in cancer. The clinic can charge whatever they want for the test. We're going to just charge our cost. So we'll send you the kit. You have to go get a blood draw, and you can get a blood draw from any blood station or a local hospital. They send the kit in, they spin the blood down, they send the kit in, you leave, and we get the results back in about a week.
And
So,
is that appropriate for Lyme's cases as well, or just cancer?
no, this is just cancer.
Okay.
So this is not Lyme, this is only cancer.
Okay.
So this is a cancer risk test. This is testing for where you're at with your cancer. So if I'm below 10, you are having a party.
Right.
Okay?
Yeah.
Without
Okay.
without too much cake.
No sugar cake.
No sugar cake. So if you haven't known me for very long, I might frustrate you because I'm always coming up with something new. So in the event of that you don't like change, you probably won't like me. So I like to constantly be researching and adding new things and studying and figuring out a new way to help people. So I have several new therapies that we're adding to our office. This year has been a big year for adding new therapies. We added the acoustic therapy, which unfortunately, if you're not a local patient, you can't really take advantage of that. But this therapy, it's called Sequix, and I'm really excited. It's out of Italy. So this is not in the U.S. yet. We, I think, will be, one of the first clinics in the U.S. that have this. I think there is one other clinic, it's a doctor that I know that has it out on the East Coast, but he practices kind of in a hole in the wall and doesn't let anybody know that he exists because he's afraid of what could happen. But I'm not afraid of what could happen, so I don't know why, but God's protecting us. This is really cool technology that is something that people could use at home too. So you're all familiar with the PEMF, the pulsed electromagnetic field therapy that we use in our office. And we use the Pulse brand of that, which is very high frequency PEMF machine. Well, this is a different type of, you could think of it as a PEMF, but it's not really a PEMF. It is a frequency machine that's using electrical frequency in a pad, and it is programmed to your body. So because it's not light frequency, we scan you, you lay on this pad, and we connect you to these electrodes, and we scan you for your 9 top frequencies. And there are about 30 different frequency types. If you are into physics, you have sine wave frequency, square wave frequency, sawtooth frequencies, a whole bunch of different types of frequencies. So this machine scans you over those frequency types, and it comes up with the top 9 different frequencies. And then we encode a card with that frequency set that we're going to use for you, and then we treat you with it if you're at our office. But many people have asked, can I get a PEMF unit for home? And the struggle is they're very expensive. The cheapest that I've found is the $7,000 one, and I've had multiple people buy it, and I think it's a really good machine. This is going to be about $4,500, and we can encode it and imprint it for the frequencies that you need. That every time you come back to visit us, let's say every 3 months, we can scan you again and give you a new card. So as your body changes, we give you a new program that you'll use, and you can use it every day. And it's typically about a half-hour program, and you just lay on it, and you don't feel very much. I did it at the seminar a couple times. The second time, I fell asleep within 2 minutes, and she had to wake me up. It was a little embarrassing, but it was so relaxing. I said, I I'm getting this. I tell you, I don't know what it's doing, but I feel great. I'm getting this. And this would be great for patients. So the struggle is, boy, I can't afford another $7,000 piece of equipment. This falls much more affordable for people. We may even rent them out. I haven't decided that yet, but we're going to try to make it affordable just for another tool for people. And certainly local patients can come in and do it. So I'm super excited about this new thing, and it's going to be really cool. So it's going to be another nice piece of equipment for our office. Any questions on that?
Have that now at the office?
They are delivering it on next Wednesday. So you're going to be here. So when the lady's coming to deliver it and set us up and go through a training.
Cool.
So you're going to be able to experience it, Mike. So that's pretty cool. We're excited about that. Another new piece of equipment that we're getting is plethysmography. That is a study of your vascular health. And you go, what does this have to do with cancer? Well, it does have a lot to do with cancer because it has to do with bringing oxygen to the tissues. And I have said this multiple times before, just because I have a disease doesn't mean that I can't have more than one. So just because I have cancer doesn't mean I have a perfect heart and I have perfect blood sugar and I have perfect kidneys and I have perfect everything else. Usually if I have a serious disease, it was the result of some other things going on that could affect other organs, and I have the right to have more than one thing going on at the same time. And we have used autonomic testing on every one of you, and we measure the sympathetic parasympathetic balance. But that's all we measure with that test. This new piece of equipment is going to measure sympathetic parasympathetic balance, but it's also going to measure your blood vessel health. So that's going to be the elasticity of your arteries, how well your arteries are carrying oxygen, give you a very good data on whether you have any cardiovascular health issue, any blockage of arterial flow. And there's 7 known types of vascular health, and it will put a person in whatever percentage type it is. This would not be normal for a person to be 100% type 2, but it'll put a person in a percentage of where they're at and give you a risk factor. And that would give us some data whether we want to move forward with getting you in to see a cardiologist too, or getting a lipid panel done, or whatever else that we want to get done to look a little deeper on that, because that can be a factor with both Lyme and cancer. If we can't oxygenate a tumor, we can't kill a tumor. So somebody asked a question, why would you do hyperbaric chamber with cancer? Because it increases oxygenation of the tissue. And if we can oxygenate a tissue, I always say, oxygenated tumor is a happy tumor, meaning it is going to not be able, it's going to be happy, it's not going to grow anymore. So if we can oxygenate a cancer, it's going to kill the cancer. So if we can't oxygenate it because we have nitric oxide issues, we have vascular issues, there's different things that we could do to support the vessels from a natural perspective to help increase oxygenation. But we really want to have something that we can measure first. And this will help us without doing a scope on your arteries. This will help us measure it. So this is not like I would say new information. That's new data. It's just a device that's been out for several years. I actually looked at it for the last couple of years. It's very pricey, and I thought, well, gee, how is this going to completely relate to cancer? But the more you study an oxygenation of cancer, and this is just going to be another nice tool for us. So this will be incorporated on everybody's exam and re-exam. So if you come back to get another re-exam, we'll be testing it. It's actually really simple. But it's the technology that's in the computer system that gives us the complexity of the test. So this is going to be another nice test we'll be adding on your re-exam.
And what's that test called again, Dr. Connors?
It's called plethysmography.
Well, that sounds simple. Okay.
Yeah, just say that 3 times fast.
Yeah, really. Okay.
Like David could use that.
Yeah,
Yes.
still trying to figure out this cardiac thing that's happening
Yeah.
with me, so we could talk about that.
Yeah, well, you just need to move to Minnesota.
Yeah.
Don't you want to come to Boston?
I do want to come to Boston. That would be fun.
Come on, we'll put you up.
All right, it's a deal.
Okay, I've got that down.
So anybody else have any other questions?
I have a quick one. If I'm going to make a journey to a technician who has pulse electromagnetic frequency service, how long of a appointment would I ask for?
You want to do it for an hour.
1 hour.
Yep.
Okay.
Yep, I do it
Alrighty.
for an hour. And do they have the pulse?
They do.
And you could have them call our office and ask what frequency we ran you on and everything and where we placed the pad.
Oh, good point.
Yeah.
Okay.
So we want to be in contact with your local doctors that are doing things. So have them, then we can co-treat, and that's always benefit for you.
Okay. Okay, sounds good. So how does a Lyme's patient know if they're getting better?
How does a Lyme patient know you're getting better? Well, the easiest way for a Lyme patient is totally go off your symptoms. Because part of the problem with Lyme is identifying it in the first place in the blood work, and you're going off of your symptoms when you're measuring your success.
Okay.
So if your energy increases and you're starting to, your fatigue is decreasing and you can start living your life a little bit and you're starting to feel like you get your life back, you're winning the battle.
Awesome. Okay. Thank you.
All right. Well, we are way past our time. I'm open to staying for more questions if you have them.
I have one more.
Uh-huh.
I've got a bunch of test results done with my doctor here who supports you and knows you. And should I send those to you before we meet so you can look them over?
Yes, that'd be good. If you could email them to me, that'd be great.
Great. Okay.
All right. So I'm going to save this recording and it'll be up on Facebook in the next 20 minutes or so. And make sure you email me your questions that you have so we can make sure we get them addressed every week. All right. You guys have a Merry Christmas. If I don't see you again, make sure you look at Facebook and watch the videos that are on there and make comments and ask questions that you have too. And have a very Merry Christmas.
Yeah, thank you.
Hey, Merry Christmas to you too and your family.
You as
Many
well.
blessings
Thank
to
you.
you.
Thank you. Thank you. Bye-bye now.
Bye.
Bye.